Good morning, Karol. We've been talking this morning, this terrible report into the state of the NHS on the same day that we hear Sarah Ferguson urging people to get tested. It's actually a really important message, isn't it, when a lot of people feel demoralised with the state of the health service?
Absolutely. I mean, it is working, there's no doubt. Industrial action takes its toll, but there's no doubt the system works. And if you have an abnormal mammogram, as Sarah did, she promptly got the lump excised, diagnosis made, and a treatment plan will have been formed. Breast cancer is a great cancer. 95% of people will be cured of their disease if it's caught early, and I'm sure Sarah will too. The treatment has to be designed for the individual, not just the size of the tumour, the type of tumour, its molecular characteristics. They all factor in, and then a treatment plan will be made.
She uses very interesting words, Karol, doesn't she, when she says, get screened, get checked, doesn't matter if you feel fine, cancer can be silent. I was very struck by that phrase, cancer can be silent, which it was in her case because she had no symptoms and she hadn't found a lump.
Exactly. Cancer is silent. Often there's no pain at all. People think it's going to be dreadfully painful, and that would alarm. If you have pain in the breast, for example, it's much more likely to be a bleeding cyst or an infection of some sort rather than cancer. Cancer is silent. It grows and destroys the nerve receptors around it, wherever it is in the body. So pain is not common. Now, the thing about Sarah's cancer, thank goodness, it's an early tumour. It's localised almost certainly. And that's the benefit of screening. And we've heard just now about the lung screening programme for those at high risk from lung cancer. The same concept. If cancer's picked up early, it's totally curable by modern medicine. It's when it spreads, it gets more difficult. Some are still curable, but it's much more difficult to deal with.
Is this one of the things that the NHS is actually good at, Karol, is the early diagnosis and then getting the treatment as soon as possible and tailored to the right person? Is it one of the things where we are still leading the way?
I think that, public health is one of the things the NHS leads the world on. So screening, the mammogram program, now the lung cancer program, the testing for colon cancer by looking for blood in the poo, that sort of thing. We do it very well. Population-based screening, as it's called, but everybody's welcome to come. Different parts of the country, different levels of uptake. We have to understand the reasons for that and try and improve it. But the NHS is really good at that. Where it is weak is the speed of the whole thing. Once you're positive, I'm sure Sarah would have got very speedy service in the private hospital she went to, a same-day service probably, being who she is. But for most people, it can take 2 months before you go from diagnosis to treatment. That's the target. And in many hospital trusts, that target, which is very generous, is just not being met. So that's critical, so that when we start treating the cancer, it's still early stage. It hasn't spread outside the confines of the organ in which it arose.
And has that delay between diagnosis and treatment, Karol, deteriorated post-COVID and also, of course, we've had a wave of strikes?
Absolutely. Both have really hit it hard. So the backlog means it's still not cleared. And I've been urging the Department of Health to have a proper programme to try and clear the backlog. Get places open at night and at weekends, get volunteers in, just like the vaccine programme for COVID. Fantastic. Everyone pulled in, got it done. We could do the same for cancer diagnosis. The biggest problem in the backlog is the delay that's now ensuing for many people. They need to be treated quicker. The capacity is there to treat them, just getting them through the whole diagnostic phase that seems to be lacking.
And is that one of the reasons why we've had so many excess deaths in 2023, Karol? Is it just the backlog of people who've been caught in this system post-COVID, where everything was, well, COVID was prioritised over everything else?
It is to do with that. At the moment, we don't really understand the excess deaths. They're there. They're probably mainly cardiac deaths at the moment, heart deaths, because heart attack patients couldn't be treated, so the heart's been weakened by the damage caused by lack of oxygen when a coronary blood vessel gets blocked. The cancer excess deaths will come later in the next year or two, because people at the beginning of the pandemic just couldn't get seen. They couldn't get a scan. They couldn't start treatment. There was no diagnosis. So unfortunately, we're going to see an excess of deaths way through to 2026 coming from cancer. And obviously this will be looked at very carefully. And the lesson, the COVID inquiry and so on, is that you can't stop services because a disease comes along. You've got to carry on. And of course, the cancer deaths and the heart deaths that have occurred in excess are in much younger people than the deaths due to COVID, whose average age was over 80. So you're balancing one set of lives for another. It's got to be a balance, and we've got to learn from that lesson.
And Karol, Sarah Ferguson's clarion call to women to get tested is very important. But of course, there's a lot of men watching this programme and listening to this programme on the radio who aren't getting tested for prostate cancer, which, if you catch early enough, can be cured. But if you don't, if it's too late, it's a terrible killer.
Absolutely. Men are bad patients. Men tend to hide symptoms. The threshold to do something about ill health is much greater in men than women. It always has been, possibly because women look after the family's health and they're responsible for it. Men tend to ignore things. So certainly some patients, and they're too stoic, and they've got to come forward and, do everything you can to get the test to make sure everything's okay. If you have symptoms, if you have difficulty passing urine, blood in the urine, do something about it immediately. Don't wait.
The other issue that this has raised today, actually, these NHS findings, we were discussing it earlier, is the concept of personal responsibility for our health, because I think there's been a sense of complacency maybe amongst the British public. Well, I can live as I like, I can enjoy my lovely food and drink, and I don't have to exercise as much as I might, because the NHS will always be there to mop me up should the time arise. And really, it feels very much like you can't take that for granted anymore.
Completely correct. I mean, I worked in the United States as an oncologist. I obviously traveled around Europe to the cancer hospitals there. So I've seen the cultural differences in medicine are very widespread. So Britain, stoic, NHS provides for everything, no problem, everything will be okay. You go to the US, everyone's very pushy. They're pushing for better care for themselves. They're going to places, they get better care. The same in France, Germany, Italy. There's almost no delays in the system. Even the Italian system, we often think of Italy as a chaotic place, but, the trains run on time and healthcare there is on the button compared to this. I mean, you can get an appointment to see your GP tomorrow if you want in Rome. You can't in London. So that's the big difference.
All right. Thank you. The fantastic Professor Karol Sikora there. Let us know your thoughts this morning. gbviews@gbnews.com.